Why do people lose their hair?
People lose their hair suffering from the condition alopecia, not to be confused with alopecia areata. Alopecia means any form of hair loss. There are a large number of causes for hair loss, some of which dietary, health can be a reason for it, scalp disorders can be another, hormonal conditions also can trigger hair loss. Natural things like childbirth will also trigger hair loss. So hair loss, alopecia, can happen for so many different reasons. Diagnosis is sometimes quite difficult.
What is male pattern baldness?
Male pattern baldness is a form of hair loss which is hereditary. It can actually come from either side of the family, and it can actually skip several generations. It manifests itself by loss of hair on the crown and at the temples first, and then generally those patches join together, leaving the top of the hair ultimately completely bald. This will affect something like 30% of men at the age of 30, 50% at the age of 50, and 70% by the age of 70, and some lucky men escape it altogether.
What treatments are available for male pattern baldness?
Treatment for male pattern baldness currently are finasteride and minoxidil. Minoxidil is slightly different in that it is not taken orally, it is sprayed onto the scalp twice a day, and has the effect of certainly arresting hair growth, but in some cases regrowing it. Finasteride being an oral drug, which over time, it does take time. Actually, in both cases, it takes about a year for these things to see whether they're effective for you as an individual. So finasteride and minoxidil have both been clinically trialled and are shown to produce hair growth in men. The other alternative at the moment is transplant surgery.
What is finasteride?
Finasteride is a drug that has been intensely researched to be used in the prevention of male pattern hair loss. It's a drug which inhibits the male hormone, and it prevents testosterone turning into DHT, or dihydrotestosterone. The DHT is the substance which actually causes the hair loss, settles in the hair follicle and causes the damage. By preventing that transference from testosterone to DHT, you can prevent the hair loss.
Does finasteride help slow or reverse male pattern baldness?
Finasteride slows and sometimes arrests totally male pattern baldness in young men or in older men that are beginning to lose their hair. It can be a very useful tool, but doesn't work for all men, works for something like 60% of them.
What are the possible side effects from using finasteride?
Side effects from using finasteride mainly are lowered libido, but also there is a concern regarding conception of a child whilst the man is taking finasteride, for fear of any distortion or problems with fetal development. Though many tests have been done and very thorough tests have been done, and it has actually required 80 times the dose of finasteride that is equivalent to that the male takes, that it was given to rhesus monkeys in order to produce any fetal distortion. So the concern is not a major one, but it's one that is taken quite fairly seriously, and men who are likely to be conceiving a child are advised not to take it.
How effective is minoxidil?
Minoxidil is very effective in some males. In others it just doesn't work. I mean, it's the same with any drug, I think. It is very good at retaining hair growth, but actually producing new growth is a little less successful.
What are the side effects of minoxidil?
Side effects of minoxidil are really quite minimal. It is possible that there may be a lowering of blood pressure, but that of course is quite a healthy thing in most of us. There is also sometimes the possibility of scalp irritation by the substance itself. and perhaps it's an allergic reaction or just mild irritation, but that is the other thing that seems to be a problem on occasions.
What is female pattern baldness?
Female pattern baldness is a thinning of the hair initially on the frontal area and the crown of the head, and it usually moves down to the sides of the head, unlike male pattern baldness, which the back and sides remain in place. In women it is lost at the sides and on the top, but the back, or the occipital area as it's called, usually remains dense.
What causes female pattern baldness?
Female pattern baldness is a sensitivity to the male hormone or the androgens within the female's body. It is hereditary. It sometimes, not too often, affects women in their 20s and 30s, but more commonly affects women after menopause.
How can you treat female pattern baldness?
Female pattern baldness can be treated, arrested on some occasions actually, by taking certain types of HRT. One has to be very careful there because some forms of HRT are known to actually perpetuate the condition. But specialists in hair and hair growth are able to treat with estrogens and with postmenopausal women, in some cases finasteride, and they can respond very well. This is often in conjunction with minoxidil being applied topically.
Why do more men than women go bald?
Men go bald because of the testosterone. Women go bald because of their ability to, their sensitivity is the best way of putting it, to the male hormone, and most women aren't sensitive to it. Some are, and in menopause they will lose hair, but the pattern of loss is different.
Can I get a test to tell me if I'm going to go bald?
You can't really test as to whether you're going to go bald. If you are losing hair, there are tests that you can have which will tell you why you're going bald, and these are usually blood tests.
Is hair loss hereditary?
Hair loss can occasionally be hereditary. It depends on many aspects, but if the health conditions are hereditary, the health conditions that cause hair loss, then yes, we have such things as thyroid. Thyroid glands can upset the hair growth. Thyroid gland problems are often caused by hereditary conditions. They don't trigger themselves. It comes through the family quite often. But there are many forms of hair loss that are not hereditary.
Can hereditary hair loss be reversed or slowed down?
Hereditary hair loss in the form of male pattern baldness can be slowed down in certain circumstances, providing it's caught early in its falling stages. Once the hair is gone completely, then nothing can be done. Where hair loss is caused by a female pattern, again it's a hormonal problem, that can often be reversed. Other conditions that are causing hair loss, such as dietary conditions, can almost definitely be reversed if the dietary condition is rectified.
Can other types of hair loss be reversed or slowed down?
Many forms of hair loss will actually reverse on their own. Many forms, such as those caused by a raised temperature, for example, the hair will be assaulted that day that you have the raised temperature, and for various reasons, particularly the hair growth cycle, it's 3 months before the hair falls out, and so it is then subsequently another 3 months before it regrows, but it will do it spontaneously in many cases.
What is the most natural looking hair transplant procedure?
The most natural hair transplant procedure is micro transplants, which are commonly done in male pattern baldness, but are used for other conditions such as scarring, even with beards, and for scarring of the scalp. These are just small transplants, 1 or 2 hairs at a time that are transplanted. They are very natural.
What is hair restoration surgery?
Hair restoration surgery is the transplantation of hair, or rather the redistribution of hair. Hair that is removed from the dense area, particularly in male pattern baldness, the dense area being at the back of the head. That area is rarely lost in male pattern baldness. It is removed and transplanted to the top of the hair, to the top of the head. Having done so, because the hair follicle is also removed and transplanted, the hair will then grow until into old age and go grey and be permanent. It can be done in 3 forms. It can be micro-transplant surgery, where hair is taken from a sort of strip at the back of the head, which is stitched and heals so that it's virtually not seen, and then transplanted. It can be done with removal at the back of the head from cylinders, sort of cylindrical pieces of scalp removed, and then the hair transplanted into the top. Or the other form of hair restoration, which isn't really restoration but is cosmetically very acceptable, is where scarring has taken place on the head and you've got a sudden bald patch through an injury perhaps. It's possible to take a scalp section, sort of remove a piece of scalp and put sort of take a tuck in it effectively, so that you can remove the bald area and stitch the hair bearing areas together and effectively do away with the bald patch. But that only happens in small areas and where it is a scar.
When should someone consider hair restoration surgery?
You could perhaps consider hair restoration treatment, particularly in men. With women, it's not usually done. It tends not to be. With men, it's more readily acceptable insofar as it is easy to see, or fairly easy to see, how far that hair loss is likely to go, and therefore the surgeon can predict whether or not the surgery is going to be satisfactory. So in male pattern baldness, if the man isn't likely to be going extensively bald, then it can be considered. The other reason for using surgery is where you have scarring, because in some cases it is possible to transplant hair into a scar successfully, so that you can remove small areas of hair from the back of the head onto a nasty scar that's visible in the front of the head, for example, perhaps after a car accident or something. And that is another possibility for using hair transplant surgery.
What developments are there with regards to hair loss and stem cell or gene therapy?
There is current research going on at the moment which is likely to lead to help with baldness, where stem cells are concerned, and that is promising, but it's still in the research stage. And so stem cell research is very much on the cards at the moment as a means of help for male pattern balding particularly. Genetic and the genetic inheritance and the effect of genes on your hair is possibly the most likely for actually producing a cure, because it can be done hopefully in the future before the balding takes place, rather than dealing with a bald head and then producing hair from it.
Are there any natural remedies to hair loss?
There are no natural remedies for hair loss, simply because hair loss has so many different causes. You have to diagnose the reason in order to treat the condition, and thus far we've found no clinical trials that will prove that a natural remedy will cure all.
Why do natural remedies appear to work?
Natural remedies appear to work based on the fact that many people suffer from a condition called telogen effluvium. This condition is where you have some form of assault to the hair. It may be dietary, it may be having been unwell, and due to the hair growth cycle, the hair will fall some 3 months after the assault, so that the person who's suffering from sudden hair loss will not associate their hair loss with the assault 3 months previously, and they will just see the hair dropping and they will panic. They will buy a natural remedy. The truth of the matter is that with telogen effluvium it will spontaneously regrow, and so that they're taking the tablets at the same time as the spontaneous regrowth is taking place, and so feel that the therapy that they've been using is working.